I worked as a child therapist, working with kids who'd been traumatized by family violence, and I got health care through my job. When I was 13 weeks pregnant, I found out that the baby had gastroschisis, which is a birth defect, in which her abdomen didn't close properly during formation. And so basically there's a hole in her belly, and her large and small intestine were outside of her body and utero. That meant that at birth, right after birth, she would have a surgery to place her intestines back into her abdomen, and then they would do a surgical closure on her stomach. And it came time to schedule a surgical consultation with the pediatric surgeon. And, at the time, I had insurance through my job. I didn't think it would be any problem getting the care we needed. I already knew that the prenatal care was considered in-network, and they also had already told me that the NICU, like the hospital itself, was in-network. So I didn't think that there was going to be any problems. But I did get a phone call back saying that they didn't have any pediatric surgeons that were considered in-network, and that the consultation would be $400 to go talk to them about what the surgery entailed. Then they informed me that her surgery then wouldn't be covered under my insurance. All the pediatric surgeons there were considered out of network. And my insurance, I had a $10,000 deductible, a $2,000 out-of-pocket expense. And then after that, if that was met, they would cover 80% of the surgery. I was about 20 weeks pregnant at that point, about 5 months pregnant. I had already started receiving the high-risk care at this clinic for 2 months. And I was pretty devastated because I was worried then that we had to find a whole new doctor to deliver her, and we wouldn't be at that hospital. And I started checking out my options through our insurance. And it really was a mess because the insurance gave me a few names of pediatric surgeons that were considered in-network, and I had to call to see what hospital they were affiliated with. And I found 2 issues. One was some of the hospitals didn't have a level 4 NICU, and that's what she needed for her care. So a lot of the surgeons that were considered in-network worked at hospitals that had like level 2 NICUs, so it wasn't an option. And then the other issue was when trying to get more information about the pediatric surgeons, there was a few that had no experience with gastroschisis repair, and I did not feel comfortable having someone who hadn't seen this or experienced this or done at this surgery before to do it. They didn't really give me many options. They just would give me more names of people to call. I even checked way out in Westchester. I checked in Long Island. They gave me a few names outside of Manhattan. They also, when they gave me hospital names, they didn't know if it was what type of NICU, if it was level 2, level 3, or level 4. And so I had to make a lot of phone calls during that time to find out.
So you called all the names they suggested?
Mm-hmm. They said talk to the pediatric surgeons at Columbia, see if they could make any exceptions. But that wasn't an option either.
And then, so do you remember any of the things that people told you on the phone from the insurance company?
They were nice enough. They told me that their hearts went out to me, good luck, but at the same time, they couldn't give me any solution for these problems. I was really surprised because I figured we had health insurance, that everything would be covered, that we wouldn't have a problem, especially when I already knew that my prenatal care was covered at Columbia and her NICU stay was covered. I just figured that everything else would be covered. So, it was a real surprise to find out that her surgery wouldn't be covered. I always assumed, too, that if a hospital is considered in-network, I thought that then all the medical providers in that hospital would be considered in-network. So it was a big surprise when I found out that it doesn't work out that way.
So then you went back to Columbia Hospital and you were talking to them about how you could go about doing it.
Right. I contacted their social work department, and I just, I was pretty distraught, and they really didn't have many options for me either. But then I said, well, I'm willing to quit my job if I can qualify for, if I can get her qualified for Medicaid, as long as that will cover her care here at Columbia, that I would be willing to quit my job. And at first they said they didn't recommend it, but after telling them what I had been through and that I didn't really feel like I had any other options, they helped me with the process. Before I delivered, I actually quit my job. I think I was 34 weeks pregnant. So I just quit my job. We got on all the paperwork for emergency Medicaid. And we just put that I was not working. And then she was covered immediately under Medicaid. So we didn't use the private insurance at all.
And then once you were on Medicaid, did that go fine in terms of your coverage, in terms of getting them to pay for everything? Were you happy with the way that the Medicaid went?
Actually, yes. It went really smoothly. I haven't even received medical bills for her surgery or anything. So everything, I believe, has been processed and paid for.
Now will you be able to start working again? Are you planning on going back at some point, or do you need to?
Well, I do plan on going back. I found out that my position at Edwin Gould's been filled. But they do say that they would be happy to have me back at some point. So I think maybe when she's about a year old, I'll go back to work.
And did her surgery go okay?
The surgery went well. We got a great surgeon, one that did have experience with gastroschisis repair, and he did an awesome job. She's a healthy and happy baby. She's doing really well. We've had some minor complications, but nothing major, and they say that she's going to do really well. Thank God.